Today I'm going to compare and contrast Medicare versus Medicaid of Texas. So, Texas Medicare, they cover 65 years old and over, medically disabled people verified by the Social Security Administration. Typically, you have to have been disabled for at least 2 years through Social Security in order to get qualified for that. Any stage with end stage renal disease or Lou Gehrig's disease is also covered under Texas Medicare. Medicare is a federally funded program that is it's ran through the administration of Social Security. So, coverage wise for Medicare, you have Part A, Part B, Part C, and Part D. In Part A, this is going to be specifically your hospital stays, hospice charges, skilled nursing facility charges, some health home services. Typically, if let's say you're injured or you have an illness that's preventing you from leaving your home, typically those home health services would be covered under Part A. Part B is going to be your physician charges, preventative services, things of that nature, really anything related to physicianal care. Part C is going to be your Medicare Advantage programs. These are going to be actually outsourced through other insurance companies. So, for an example, there's Blue Cross Blue Shield offers these, Cigna, Humana. What they do is they take coverage from Part A and Part B, they combine them, and that is what they offer. So that way you have your Advantage plan that can cover hospital stays and physician fees. Part D is going to cover your prescription drug coverages. One thing that I honestly found really interesting this week was in our readings, there was a fact sheet for Medicaid and Medicare. Um, One thing that really stuck out to me was that Medicare is the nation's largest payers for hospital services for inpatient, for elderly. I really found that to be kind of surprising because I feel like now, typically today, we have a lot of people that are 65 years old or of age and older, and they are still working. So I personally would have felt like commercial plans would have been more of our bigger payers, but I guess it's not. So I did find that interesting. Next up, I will discuss Texas Medicaid. So, who this covers is going to be our lower income based off of family size and poverty guidelines. Children who also qualify under household size and poverty guidelines. Pregnant women, again, qualifies based off of poverty guidelines, family size. Um, there's also one thing I found interesting was that it does cover adult caregivers. So if you are taking care of a child or a relative in some way, and it said that if your poverty guideline was less than 14%, and if you did meet those poverty guidelines, you would qualify for that Medicaid in that scenario. So I thought that was really nice that those people are looped in because sometimes we do have situations where we do need to take care of a parent or a loved one like that, and we're not able to work. So that is nice. Medicaid is actually a federal and a state program. So on the state level, they are responsible for creating that budget, right? So the federal side will actually pay a percentage of their overall budget plan for that year. So the remainder that's not covered by the federal side, the state is responsible for covering those charges. Medicaid actually covers a lot of services. So one thing I didn't realize that Medicare does not cover, but Medicaid does cover, is mental health and substance abuse counseling. Medicaid's going to cover medications, hospital and physician fee charges, dental. There was lots of information regarding transportation. So typically, you see that emergency transportation is, normally covered under like Medicare. However, with Medicaid, emergent and non-emergent transportation can be scheduled and covered under Medicaid. The biggest similarities on the two programs was that you do need to be a resident of Texas for the state of Texas in order to receive Texas Medicaid or Medicare. You do need to be a U.S. national citizen, and then you also, of course, need to have the need of help with health insurance in order to qualify for that. Biggest differences here are going to be what they really cover. So, of course, both cover hospital and physician charges, depending on if you're choosing Part A, Part B, or if you're going with the Advantage plan with Medicare. But with Medicaid, it covers just so much more. So, if you are below poverty guidelines and you are able to qualify for the Medicaid program, the mental health, dental, things of that nature, it's going to be more of kind of your more rounded program. So, specifically, I think of children who are on Medicaid. They need to go to the dentist, they need to go to their yearly physicals, things of that nature. So, hopefully, that's going to cover a little bit better than Medicare specifically, who's going to be more for our elderly and our disabled.